So, Doctor, let's talk about all of these issues and more. The Secretary of HHS saying that vaccines were the best way to prevent measles, also talking about other things that one should or could take to mitigate that. What is your reaction to all this?
Now, as both an emergency physician and as the dean of a school of public health, I am thrilled that Secretary Kennedy is endorsing the measles, mumps, and rubella vaccine. To be clear, it is unbelievably safe and it is unbelievably effective, and it is the only proven way to prevent transmission of measles. When kids get both shots, 97% of them are protected from catching measles, which means that it protects them as well as those around them. And measles is an unbelievably contagious disease, perhaps the most contagious virus that we know of. If you are not vaccinated, your risk of getting infected, if you're in a room with someone with vaccines, is as high as 90%. So I'm thrilled by that. Unfortunately, I'm not so thrilled by the promotion of potential treatments or prevention strategies which have not been shown to work. To be clear, there is no treatment that cures measles. Vitamin A may help, particularly for kids who are severely ill, but only when administered by a healthcare professional and only in careful doses. The other things like budesonide and clarithromycin that he's been advocating for, there's no data to support it. I'd love to see a clinical trial, but as of today, I would never substitute that for the sort of care that a kid would receive in a hospital. And unfortunately, by the time a kid does get to be severely ill, it's just supportive treatment that we can give.
So, this child that passed away tragically because of pulmonary failure, is that just traditional way that measles attacks the body? And the other thing is how effective, not only, you talked about the effectivity of it, but how safe are these vaccines?
Yeah, so what measles does, it attacks your body, it attacks your immune system. Many kids get better after getting measles, but about 20% of them, or 1 in 5, end up with pneumonia. That pneumonia can then progress, become respiratory distress, require intubation or a medical coma, and can eventually kill a kid. Measles also can cause brain swelling and immune amnesia, where you lose the ability to fend off other infections. So it's a tremendously dangerous disease, unfortunately.
Dr. Megan Ranney, I thank you so very much for being with us. Really appreciate your time.